Hi everyone. In today's clip, I will talk a little bit about vitiligo. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So, vitiligo is a condition where areas of the skin lose pigment and turn white because the cells that produce melanin, called melanocytes, are either damaged or destroyed. Modern medicine largely views this as an autoimmune condition, meaning the immune system mistakenly attacks pigment-producing cells. Vitiligo can appear as small white spots or large white patches, symmetrical or asymmetrical areas, white hair in the affected regions, with sometimes loss of color on lips, inside the mouth, or around the eyes. Common locations are hands, face, around the eyes and mouth, elbows, knees, genitals, and feet. There are several forms of vitiligo. There is segmental vitiligo, which is most common and is usually bilateral. Then we have segmental vitiligo, which is one-sided, often during the earlier onset. And we have universal vitiligo, which is widespread depigmentation. And we have also focal vitiligo, which shows as localized patches. So vitiligo itself is not dangerous, it's not contagious or infectious, but psychologically it can feel like living in a body where the pigment, so the constellation map, is being redrawn overnight. Modern dermatology believes vitiligo is influenced by a combination of autoimmunity, genetic predisposition, oxidative stress, nervous system factors, environmental triggers, and possibly gut and inflammatory pathways. Now, other associated conditions can include thyroid disease, alopecia areata, type 1 diabetes, pernicious anemia, and other autoimmune disorders. At present, modern medicine says there is no guaranteed permanent cure. However, many treatments can stop progression, trigger repigmentation, improve appearance, and sometimes restore large areas of pigment. Some people experience actually spontaneous repigmentation naturally. And modern medical treatments include topical corticosteroids, which is used especially early on for the purpose of reducing autoimmune inflammation and encouraging melanocyte recovery. Doctors may also prescribe calcineurin inhibitors to suppress local immune attack without some of the steroid sort of side effects. They also may suggest narrowband UVB phototherapy, which is now one of the most sort of established modern treatments, as well as the uses of controlled ultraviolet B light to calm the immune attack and stimulate melanocytes and encourage migration of pigment cells, and it's usually done 2 to 3 times a week for months. Next, there is laser therapy, which is targeted UV light for smaller areas. Also, they may prescribe JAK inhibitors, which is a new FDA-approved topical drug to block inflammatory immune signaling pathways called Janus kinases. There is absolutely a lot of excitement, of course, around JAK inhibitors, though they are not yet considered a cure. Then, of course, there are surgical approaches such as skin grafting, melanocyte transplantation, and cellular grafts, which are specialized sort of procedures. On the orthomolecular medicine side, we generally see vitiligo as connected to oxidative stress, nutrient deficiency, detoxification imbalance, gut dysfunction, autoimmune dysregulation, and nervous system stress, and we focus on restoring the biochemical train. Now, common supplements that are suggested for vitiligo are vitamin B12 plus folate, as this has shown repigmentation when combined with sun exposure in the dosages of B12 being around 1,000 to 5,000 microgram daily, and folate for 1 to 5 milligram daily, and sunlight or phototherapy is often paired with it. Then there's zinc for melanin production and immune regulation, with dosages ranging from 15 to 50 milligram elemental zinc daily. But too much zinc long-term can deplete copper, so it might be coupled with copper, as it is important for tyrosinase, which is a melanin-producing enzyme. And the dosage for copper would be between 1 to 3 milligram daily, and it's usually balanced carefully with zinc. Then there's vitamin D3 and K2, because low vitamin D is common in autoimmune conditions, and the dosage is around 2,000 to 5,000 international units daily, sometimes higher under supervision. And antioxidants, because vitiligo is strongly associated with research with oxidative stress, and they include N-acetylcysteine or NAC, 600 to 1,800 milligrams daily, alpha lipoic acid or ALA, 300 to 600 milligrams daily, selenium 100 to 200 micrograms daily, vitamin E 200 to 400 international units daily, and L-phenylalanine, which is an amino acid precursor related to melanin pathways and sometimes combined with UV exposure. And the dosage for this would range from 500 to 1,500 milligrams daily and is not suitable for people with PKU. Then we have ginkgo biloba, which is recommended because it may slow progression in the dosage of 40 milligrams 3 times a day, or 120 milligrams standardized extract daily. We have digestive and gut-oriented approaches, including probiotics, exploring and eliminating food sensitivities, eliminating leaky gut, and providing liver support. So controlled sunlight exposure has a long history in both traditional and modern systems. The idea is that UV stimulates melanocytes, as well as certain plant compounds, make skin sort of more photosensitive, but excessive sun can also worsen contrast and can cause burns. Traditional medicine sees depigmenting disorders in the framework of humoral medicine. Looking at traditional and old medicine that our ancestors followed, this is interpreted through humoral imbalance. As I have mentioned in my previous clips, we have 4 humors in the body. There's blood, which is warm and moist. We have yellow bile, which is warm and dry. Black bile, which is cold and dry. And phlegm, which is cold and moist. These are also called temperaments. So vitiligo-like conditions were often connected to imbalance of black bile or phlegm, weak transformative sort of faculty of the skin, digestive weakness, liver dysfunction, and improper humoral balance. Traditional medicine viewed skin disease as reflections of deeper systemic imbalance. So historically used methods sort of include sunlight plus photosynthesizing herb. This is fascinating because it parallels later PUVA therapy that they use nowadays. And the traditional plants included sorrelea, celery, parsley, and fig sap. These contain sorrelin-like sort of compounds that increases UV sensitivity. The approach would be to apply or ingest the plant, or ingest the plant preparation, I should say, and have controlled sun exposure, which causes gradual stimulation of pigmentation. And this ancient sort of thread eventually echoed into modern PUVA medicine centuries later. Next, we have liver and digestive support, which is heavily emphasized, and it includes gentle detoxification, improved digestion, avoidance of cold and moist foods, use of bitter herbs, warming spices, and traditional herbs like black seed, fennel, cumin, chicory, turmeric, and saffron. Next is the blood purifying concepts, and the traditional system often um, um, used are through use of burdock-like herbs, bitter tonics, sweating therapies, and dietary cleansing approaches. The old medical language differs from modern biochemistry, but many traditions see skin disorders as internal imbalance made visible. Foods often encouraged, depending on the system, have always been including basically sesame, black seeds, walnuts, lentils, dark leafy greens, copper-containing foods like organ meats, nuts, seeds, whole grains, legumes, potatoes with skin, avocados, bananas, and more, as well as mineral-rich broths, and avoiding excess sour foods, highly processed foods, heavy dairy, excess cold or raw foods, and psychological and emotional burdens. Vitiligo has long been associated with emotional stress in both traditional and modern observations. The person with this skin disorder is very much in need of taking life a little less seriously and trying to concentrate on the good they have rather than focusing on all that they think they're missing. This kind of stress definitely triggers onset and worsens the progression and influences immune activity. Unfortunately, no amounts of external vitamins or nutrients will be enough if you are working against it internally. Whole body equilibrium matters the most. Strangely, across centuries and entirely different medical languages, one theme keeps resurfacing like a moonlit thread sort of through history. The skin may be speaking, but something deeper than this, about something deeper than the skin itself. Hope this has been helpful. My clips are available on TikTok and YouTube. Like, share, and follow for more. Be the light.